3.
Hey everybody, thanks for joining us today. I'm Eric Branning, Senior Program Manager for Behavioral Health at Blue Cross Blue Shield of North Carolina, and I'd like to introduce my partner, Srishti.
Eric, thanks. So glad that we get to talk today. For everyone, we're going to be talking today about expanding access to substance use disorder treatment, both inside and outside of this global pandemic. So Eric, to get started, do you want to take a moment to introduce yourself?
Yeah, so as I mentioned, Program Management at Blue Cross. Before that, I was at the Children's Hospital of Philadelphia for about 6 years, doing some enterprise improvement work. And at Blue Cross currently, I have a portfolio of programs that span mental health and substance use disorder, the largest in my portfolio being Eleanor Health.
Great. And by way of a quick introduction of myself as well, my name is Srishti Mirchandani, co-founder of Eleanor Health and previously Vice President of Growth Operations, and have most recently went on to lead our new market in New Jersey. Right before Eleanor Health, I was spending time with the Oxyon Venture Studio, where actually Eleanor was first conceived and born. And prior to that, spent my career across consulting and healthcare in the transformation towards value-based care. A lot of those principles that have now been applied into building Eleanor.
And so we wanted to talk about essentially like how all of this came to be. So, why collaborate with Eleanor? How did all that get started? And so at Blue Cross North Carolina, we're really trying to expand access to behavioral health services, in particular outpatient services. And so when we looked across the landscape, we realized that we were looking for a high quality partner in North Carolina that was using evidence-based practice and was interested in a future state into moving to more of a value-based kind of contract. And, we didn't entirely find a partner that was appropriate. And so we started asking around and we landed with a strategic alliance that ended up building Eleanor Health. So Srishti, do you want to give us a little bit more context?
Yeah, absolutely. So the very origins of Eleanor Health really started with looking at opioid and substance use disorders as the massive public health challenge that they are. So I mentioned I was previously spending time with the Oxyon Venture Studio, and that's a group that's really tasked with finding intractable problems in healthcare and then creating and investing in solutions to meet those outstanding needs. So Eleanor Health was born of that mandate. We started with looking at opioid disorders alone, but quickly with the feedback of a number of clinical stakeholders, including Kate Knutson at Blue Cross in North Carolina, really went on to encompass substance use disorders for the fact that those are co-occurring concerns of most of our patients. So with similar type of feedback across clinical, financial, strategic dimensions, we really went on to iterate on the design and concept in answering the question of how can we completely rethink addiction treatment? In particular, how do we make it both better and a more human experience? How do we create best-in-class patient outcomes and align those outcomes with an individual's motivation for ongoing recovery? And then how do we integrate with the communities where our Eleanor Health future patients would be? So in answering those questions, that started to build the pillars of Eleanor Health. Along the way, and early on along the way, in conversations with the Blue Cross North Carolina team, we found a level of vision alignment, strategic sponsorship, and operational execution and know-how that just created this wonderful opportunity for collaboration in standing up Eleanor Health first in North Carolina and really support that transformation of how addiction treatment could be delivered.
Yeah, and so launching the behavioral health strategy at the health plan, it made sense for us to look for where we wanted essentially strategic alliances in intervention. And so Eleanor really met that outpatient slot. And so I'm going to talk a little bit more about the program launch. So essentially from where I sit in the health plan, I work on sort of a team of program project management. And one of the things that we do is sort of like life cycle for these types of programs. And so, of course, like Eleanor's new, a lot of what we're doing is new. And so I have the best-in-class solution portfolio, and I sort of joke sometimes that whenever we don't know what to do or how to do it, we give it to me, and so I try to figure it out. And so being there from essentially, sort of the transaction through kind of like the letter of intent, so all the legal documentation, non-disclosure, services agreement, really transitioning sort of implementation into operations for Eleanor and the clinics. I view part of my job as being a sort of relationship manager and advocate to help navigate successfully internally, just because we appreciate that there's a level of uncertainty on how to do certain things.
Yeah, absolutely. Well, that's a fun and critical role that you play, Eric, that's for sure. And from our perspective, from the company perspective, working in tandem with Blue Cross in North Carolina has been absolutely critical to support that launch and ability of Eleanor to deliver on this vision. As we all know, healthcare is incredibly complex, and unfortunately, the barriers to innovation are very real. We each, as entrepreneurs, need partners and collaborators who don't just big and don't just think about the next idea, but actually have the grit to move obstacles out of the way. That's the type of partnership that we forged with Blue Cross North Carolina, and we continue to forge as Eleanor grows across new markets as well.
And I think that this type of collaboration is particularly useful for our members because it really does expand access to items that we identified were a need in the first place. And I think it's particularly helpful to have somebody as a point of contact in each organization. And so, I can do things like figure out who to talk to in legal or compliance, or better understand the different products or lines of business or segments and how, Eleanor may or may not be in those, and how can we explore opportunities to add them where appropriate for that population. And so this type of population health management, and so a little bit of a navigation on the health plan side, for me has been fun and interesting, and I hope it's been sort of helpful for you guys.
Yeah, absolutely. And I think actually I'd add on one more thing to that as well. Not just navigation within the health plan, but navigation in the community, especially as a Blues plan and with that long, rich history in the community and serving the whole state of North Carolina, the ability to help Eleanor realize where we can have the most impact across the state, not just geographically, but with other collaborations. I think Blue Cross in North Carolina has been an incredible partner, and Eric has been our main contact person to make some of those relationships happen internally and externally to the plan.
And it's been really great that we have goals that are aligned. So, perspectives from each, we're looking at reducing the total cost of care. We know that substance use disorder is the number one driver for the emergency room and inpatient. We know that there are a lot of barriers to entry. I think that for Eleanor, especially the respect that substance use disorder is a chronic disease and is treated as such. And I really think that the fact that you don't fire patients is particularly great.
Absolutely, and as do we. But also, unfortunately, it's not how the world works for many who are seeking addiction treatment. And so in building and designing and continuing to execute on the Eleanor vision, that means expanding access to care and evidence-based care for substance use disorders in multiple dimensions. So when we talk about access, we're talking about geographic access, which, as I mentioned, Blue Cross North Carolina helps us to even figure out and align on what geographies Eleanor will have the most impact on. Financial access, so just the fact that we are in network with a payer helps more people to be able to access appropriate services. But also cultural access. And what I mean by that is the stigma around behavioral health, as we all know, is incredibly strong. So when we talk about not firing patients, that's one dimension of it. It means that by not firing patients for a relapse or a near relapse event, that we instead wrap our arms back around that patient. We don't fire them away from our care, therefore providing them longer term, more effective care, better clinical outcomes, lower total cost of care, but also just a much better individual person experience. So that's what we're able to do by working together and by sharing that vision. I think a key part of how we felt alignment early on with the Blue Cross North Carolina relationship was also this realization that not only did we want to together provide higher quality care to members, but we also wanted to retain that individual in care to really support a long-term remission and recovery of that individual. As we know, substance use care is often episodic, and so trying to align across having years, decades of doing this differently in many ways, that partnership with Blue Cross North Carolina helped us to create the right incentive structure that allows us to take care of patients for that long term.
And the intent is to have a longitudinal relationship for at least 5 years. Is that right?
That's exactly right. So completely changing the time frame from how most think about substance use care, which is often conceived of in short stints that might be at an inpatient rehab or other facility away from the community, whereas Eleanor services are really about surrounding you in the community and life that you're living in, but providing accessible in-clinic and virtual care to provide that whole person set of services that are more accessible to you in those various dimensions.
And I think with the member in mind, their goals are important too. And so Eleanor has a harm reduction model, and so it's not imperative that the member be abstinent from substances.
That's exactly right. So when we talk about not firing patients, that is part of the core of it, is having a harm reduction model, understanding that not every member's goal is going to be 100% abstinent from every substance that they use. There might also be a progression to how they stop using certain substances. So we work together with each community member to set those goals, and over time continue to meet with our evidence-based treatment to meet the goals of the individual patient, supported by medication, supported by therapy, psychiatric services, nurse care and management. So really helping to create that whole system of support for the individual.
And I think when members get into care in sort of a more appropriate acuity level, for instance, outpatient, I think that the care is sort of better, more appropriate. And we talked a little bit about the total cost of care. And so when we think about expanding access as well, the clinical footprint in North Carolina currently has about 5 clinics, and we're thinking about having more. So can you tell us a little bit more about that?
Yeah, absolutely. So expanding access to us, again, I mentioned there are multiple dimensions when we talk about access. Clinic sites are one part of that. It's the most easily understood part, because you see these actual freestanding 4 walls to a clinic, to the outside of a clinic, and you see those distributed across the state of North Carolina. Our very first one at Eleanor opened up in September 2019 right outside of Charlotte, North Carolina. And as Eric mentioned, we have 5 sites now across the state of North Carolina, as well as telehealth services that provide our whole scope of care across the state. Those clinic sites, though, we make sure that they're accessible in multiple ways, even as we build them out. So for instance, targeting a location that's close to a bus line or public transit. That's a really important criteria for site selection. So we want to make sure that not only are we standing up these new clinic sites at dense urban areas, but we're actually targeting areas that are where members need the most care, the most support, where the system of care needs an additional partner like Eleanor to come in alongside the existing healthcare ecosystem and community support ecosystem. And that's one way that we expand access. But another way, and I think Eric would love for you to expound upon it a bit more as well, that we've worked together with Blue Cross North Carolina, is on looking at data to inform some of these decisions.
Mm-hmm. Yeah, and that's always a critical piece. So, where we can be helpful on the back end with data is that we can look at where a need might be greater in a particular county or particular community, and we can help navigate and connect Eleanor with those relationships, and also plan potentially for an appropriate relationship or introduction to a health system that there might be a creative partnership with, but then also simply looking at where it might make more or less sense to put a clinic physically. And so I think that, we have a vested interest in success, not only for reducing the total cost of care and expanding access for our membership, but also to be able to, set Eleanor up for success where possible. And I think that's a great benefit of not just being a provider in the network, but being a provider in a strategic relationship attached to the behavioral health strategy. And so there's more of a dynamic conversation that is had, and in particular that is through the data and what does the data say and what makes the most sense to do.
Yeah, absolutely. And one of the things that we actually haven't had a chance to talk about too much recently, Eric, but obviously it's on everyone's mind with the COVID-19 changes. What have you seen as some of the biggest implications for Blue Cross North Carolina members and how that comes down to working with partners like Eleanor?
It's a great point. So our chief medical officer always says that what you pay for signals what you value. And so, he's made a commitment to expand telehealth reimbursement at parity. And we were one of the first plans, I believe, to do that. And so on a recent interview with Jess DeMassa, who's also here today, for What's the Future of Health, he cited that, if it's up to him, he's going to leave the telehealth switch on. And so I think that that's particularly important for a variety of reasons. And, one of which is that Eleanor's clinical model can now essentially be done entirely virtually. And so, I know you guys have been seeing a lot more patients via telehealth and can start your sort of model new patient first appointment over telehealth. And that's a really big and great development. And I think the other thing too is with telehealth, previously and there's a lot that goes into this, but things like, what line of business do you have? What code can you bill for? Do you have a product that's asynchronous? Do you have live clinicians? Are you recorded? Does it have to be audio and video? Like, there are a lot of really, weedy pieces that are typically attached to a telehealth. It's in the telehealth policy, but it's sort of relative to the group and the product. And so it starts to get into more of an insurance kind of nitty gritty. And I think with the expanded access, in particular for substance abuse, as other clinics and providers, potentially are closing their doors, not only do you guys keep your doors open for those that need it and want to come in person, but you've essentially been able to move to a virtual model that's quite robust, and being able to start medication assisted treatment and being able to do things like drug testing virtually. Like, can you tell us a little bit more about that?
Yeah, absolutely. So when all of this started to unfold, and that principle of Eleanor has just really took hold of it, continuing to expand access to services for those who need it. So it wasn't just about expanding access anymore. It was also about ensuring that our members who are already in Eleanor's care continue to have their full set of services available to them. As Eric mentioned, that's the medication, that's psychiatric services, therapy, as well as our community recovery support. So we had to find a way to transition all of that to virtual care. And we did so very, very quickly, actually. I think it was less than 48 hours from when the idea kind of percolated at one conversation in our organization that we had a full model able to deploy for our existing community members. Then we started to grow that to new community members as well. But a couple of things that I'd call out that have enabled that, in addition to what Eric mentioned on how certain health plans, including Blue Cross North Carolina, have really led the way for setting parity for reimbursements. A big change in the substance use disorder space was a temporary relief from the Ryan Haight Act enforcement. So as all the other substance use providers here would know, that has made a gigantic change. It no longer requires for this period of time that first visit to be in person with a patient for medication assisted treatment. And so we're able to utilize telehealth even for a new member, a first visit, and ensuring that they get the right type of care with a medical provider, but it can happen via this virtual means rather than in a clinic. So that's a huge change, and for substance use care, actually one that's been talked about for many, many years. It took this specific situation to catalyze that change, but we're hopeful that it sticks. There's a lot of expanded access to care that's been a result of that. What we've seen on the Eleanor side has been, since early March, we're now serving over 90% of our community members virtually. In fact, I'm happy to expand upon it a little bit more, but our second market opening in New Jersey has actually been a fully virtual opening. So every new member who comes into services, even if they live close by to one of our clinic sites, because of the public health context in New Jersey, we've launched as a fully virtual model. So they're all coming in, getting to know our team virtually, and we're hopeful that in the coming months, they get a chance to continue both their virtual services, but also community, create social relationships that are a part of recovery in our clinics as well. And I think that that's the key. That the key is we have this catalyst that's moved all of us to be more comfortable with virtual means of communication, but to be able to sustain those social relationships for recovery, we do think that in-person modes of connecting are going to continue to be really important in addition to the virtual capabilities.
And for things like group therapy and individual counseling in your integrated whole person model, they keep the same therapist or physician throughout that as well through the virtual model?
Yeah, exactly. So that is always our ideal. Obviously, there are exceptions, or when, for instance, a community member is having to change around their time very frequently, that they're coming into the clinic, there might be some changes that are made to their care team, but the idea and centrality of relationships to recovery in the Eleanor model is something that we try to really hold true to. So that means consistency with your care team, especially someone like your therapist, making sure that you're seeing the same person on the other side of the room or the other side of the video camera every week. And that's a really important part for the stickiness and retained remission and recovery.
And has your retention moved, or things like your net promoter score, has that moved kind of either way in the virtual land?
You know, we haven't had a significant move one way or another in the virtual model. So we actually think of that as a huge success that we were able to so quickly transition to virtual. What I will say has been super interesting is we've actually seen a significant increase in our internal team net promoter score during this time that we've adapted to the COVID environment. And a huge part of that, as we unpack it, has been the ability for Eleanor Health as an organization, and through the work and collaboration with our partners as well, to adapt so quickly to the environment, to provide our members with continuous care, to really serve towards our mission of helping people with addiction live amazing lives, even in this environment where that's tough for everyone. So a really interesting data point there, that we've been actually seeing that sort of feedback from our internal team.
I think that's really cool. And so I'm thinking about, again, in North Carolina, so we have launched clinics with you guys in Mooresville, outside of Charlotte, High Point, Durham, essentially down the street from the Blue Cross North Carolina campus, in Hickory and Asheville. And so, we've been doing this for a little bit now. So I think on our end with me, certainly lots of lessons learned on kind of what to do, what not to do. Even being an innovative health plan, sometimes I find, I have to reorient myself to sort of better understand a problem and figure out, there'll be always things out of your control, and anything that you want to share with the group about what you learned.
Yeah, that's a great question. So much, it's hard to distill in a couple of sentences, but I think a central theme of it is, or two central themes of it. One is knowing at the core what your principles are as an entrepreneur or as a healthcare organization. I've mentioned multiple times, even in our conversation, the principles of expanded access to care. That has been just a guiding light for Eleanor throughout our history, but including in this time of massive change in the context of COVID-19. But then second is having those principles align really closely with whoever you're working with. Call it a partner, call it a collaborator, a strategic advisor, or your internal team, making sure that that principle alignment is not just guiding you, but guiding the organizations that are going to help you break down barriers, because then you're working towards those same goals and that same North Star, even in times of a lot of complexity like this one.
I think that makes a lot of sense. And from where I am, having been in sort of a lot of meetings that I have been on the team that gets pitched to, I think some words of advice for entrepreneurs and those folks as well. Sometimes it's timing. There are a lot of good ideas. Sometimes it's funding. Sometimes it's priorities, changes in leadership. Sometimes it's totally out of control, like whether Medicaid gets expanded or not in your state. And so, I think persistence is key, but also, where you can find, as Srishti mentioned, folks that align really crisply with your mission and vision, and some of those other things make sense, that a strategic alliance can potentially be really helpful. And so, what we have is the largest private insurer in North Carolina, and a totally private entity, and sort of we living on different planes of the healthcare ecosystem, but coming together has been really positive for the population of our state. And I think that it will continue to be. And you've mentioned that you're expanding into New Jersey, and so can you tell us more about that? What else is going on? Other states planned? What's your model to scale, and how can we help?
Yeah. Well, thanks for asking. I think first and foremost, obviously, with Blue Cross North Carolina, our focus is just on making our model successful in the state of North Carolina. That means getting to more members. That means going even beyond our clinics, making sure that telehealth is successfully available to members across the state of North Carolina. And with many of those lessons learned, and some wonderful alliances in the state of New Jersey, that's what's brought us to launch our second market with Eleanor in New Jersey. A very interesting time to launch a new market. I'm sure you can imagine some of the complexities of it, but I think, again, what we're most excited by there is, in this complex time, being able to deliver a whole scope of services that are relevant to folks who are experiencing more depression, anxiety, and triggers for substance use than they may have ever before. So very excited about what we've done in New Jersey. Our physical clinic doors will open in the coming months and that's in Cherry Hill, New Jersey. So southern New Jersey, right across from Philadelphia. And we know there's a huge demand there. So we're excited to open those clinic doors as well, create those in-person relationships, and then have ambitious plans to continue growing across both the state of New Jersey as well as adjacent areas to both North Carolina and New Jersey in the coming months. So really want to take what we've learned and continue to learn and improve in each new instance of a clinic with each new member that we serve, and just always be refining and making better what the model is for best-in-class addiction treatment. So that's the Eleanor way. And we're so thrilled to partner with Blue Cross in North Carolina to continue on that journey.
Happy to partner. And thanks to everybody who's working on these tough problems. I think being in the behavioral health space now, being really in healthcare now, has been really exciting and interesting, and keep solving hard problems. I think it's great that so many smart people are involved and invested and looking at problems to really help move to health. Secretary Cohen in North Carolina always says she wants more of her dollars to pay for health instead of healthcare. And I think that's kind of a philosophy that Blue Cross and you guys at Eleanor seem to be moving towards as well. So thanks everybody for joining, and reach out to us if you have any questions.
Thanks, Eric.
Thanks, Srishti.